So now for the next artery, which we get to talk about its anatomy. Is the Dorsalis pedis artery. So the Dorsalis pedis artery is just like an artery at the back of the leg. You understand? It's an artery at the back of the foot. Okay, so it's just actually a direct continuation. Okay, I can see the anterior tibial artery here, and anterior tibial artery is just directly, continuing as well the Dorsalis pedis artery. So it's direct continuation of the anterior tibial artery beyond the ankle joint. So it runs along the dorsum of the foot between the tendons of the extensor hallucis longus and the extensor digitorum longus. Alright, that one you could actually see it better if we had a picture having the images of muscles. So it's a continuation of the anterior tibial artery that's distal to the ankle joints. So it actually begins at the anterior aspect of the ankle, just deep to the inferior extensor retinaculum. So it runs on the back of the foot. Okay, so it lies between the extensor hallucis longus tendon and the extensor digitorum longus tendon. Okay, and it terminates near the first intermetatarsal space. Okay, so what we have here next, you can see these are Dorsalis pedis. So major branches, it gives rise to branches like the lateral tarsal artery. Okay, lateral tarsal artery, this is what the lateral, just mark all the branches below this, okay, so that I won't have to come back to this image. So lateral tarsal artery, it also gives rise to the arcuate artery, gives rise to the first dorsal metatarsal artery, gives rise to the deep plantar artery. Okay, so it supplies anything at the back of the foot. Okay, it supplies the toes, the rest of it. So clinical features, you have to know about the anatomy of this artery because it helps you understand much more to why they take pulse from it, to how it can be affected in peripheral vascular disease, to how if you want to do some foot surgeries you have to now take note of this artery. Then also it will help you understand about the collateral circulation. Okay, that's how this artery gives a lot of branches that helps to now keep ensuring that there's steady blood supply to the foot.